I had a chance to sit down with Matthew Dickson, a man who beat the odds and overcame schizophrenia to become the founder of MindAid, an organization whose mission is to bring awareness to mental health in developing countries where they don't have any healthcare whatsoever. His experience and his story is truly inspiring. We sit down and get into great detail and just talk about his mission. So I hope you really enjoy it. So tell us your story. Introduce yourself.
Sure. I'm Matthew Dickson. I'm from Eastern Canada. I'm 51 years old, over the half century mark. I grew up here and lived a pretty average childhood. Nothing exceptional happened to me. Nothing traumatic happened to me, really. And anyway, I went off to university, but I didn't feel the best. I had some sort of mental stuff going on. I didn't really know what to do about it. I went to get help my first year of university. They sent me for blood work. It came back fine, and they kind of sent me out the door. So that's the way I went through university. I was taking engineering. I was getting mostly A's. And in my third year, after my third year, I bicycled across Canada. And that's a whole story in itself. Then I joined the university rowing team. I did a triathlon, but then at the end of university, in my fifth year, I started having suicidal thoughts. And I thought, Matthew, that's not good. You better get that checked out. So I did. I went to the university health clinic again, a different university. And they sent me to the psych ward in the local hospital. And that was my introduction into the mental health system. Within a matter of weeks, they had diagnosed me with schizophrenia.
Wow.
And that took my life into a whole different direction. So I had to fail out of my classes and to go into the hospital. And that's a long journey out of that.
And you're here today. So that's amazing. So if you don't mind, tell us a little bit about that backstory. What was that experience like? And how did you overcome it?
Yeah, so the symptoms were mild in university. I could still do stuff, but I was sort of muddling through life a bit. I was living on my own, living independently and whatnot, but the pain, and my symptoms, they just hit so quickly, so unbelievably quickly. In a matter of weeks, I was just, on suicide watch, and it took me so long to get back to normal again. But before I go any further on that, I want to tell people, if they've been recently diagnosed with a mental illness that's severe and they may be on suicide watch or they're incapacitated, the pain can be really bad, really bad. But what I want to tell people is that with treatment, the pain can lessen, and it may not go away as soon as you want. It may last for quite a long time. Like for me, it lasted pushing 30 years from severe to mild. So I noticed weekly improvements over those 30 years. Weekly improvements. So it was a long, slow, steady progression out of it. But when the pain is that bad, it's hard to imagine pain it's hard to imagine anything other than that pain. And people they may want to take their lives. And what I want to encourage you to do is that the pain can lessen. It may not go totally away, 100% away as soon as you want, but it can lessen. And when it does, it lets you carry on for a lot longer than you think. And my life was not the way I wanted it to be. I didn't feel like myself for, until I'm, late 40s, early 50s now. So but recovery is possible. It's possible for a lot of people. And Navy SEALs are taught in their training. You can read this in Mark Devine's book, Unbeatable Mind. He trains Navy SEALs. He creates them. And Navy SEALs are taught in their training that they are capable of 20 times more than they think they are. They're taken to the brink of physical and mental exhaustion. They say, I can't move another inch. I can't move another muscle. I'm done. I give up. And their trainer comes along and says, nope, you're not done. You've got more inside you, way more than you thought. Not 5% more or 15% more or 100% more. You've got 20 times more than you think you do. And they get up and they show them that they can keep going and keep going and keep going and keep going. And that's the way I felt I was tested. I mean, I'm no Navy SEAL, but I feel like I was tested severely in just keeping going. when there's it's well documented now that people who've attempted suicide and survived, many of them regret it, and many of them instantly regret it. Kevin Hines, he's a suicide prevention advocate. He's got a movie called The Ripple Effect, and he jumped off the Golden Gate Bridge and survived. And he said he was the same. He instantly regretted it. Think about that. Your brain chemistry goes from "there's no hope for me," I can't do this anymore. There's just no hope. There's no way out. And within an instant, your brain chemistry goes to "I want to live. I want to live. I don't want to die. I want to live. I want to be there for my friends and family." In an instant, your brain chemistry changes. And your brain can play tricks on you like it's nobody's business. And Kevin Hines says he still has suicidal thoughts to this day, but he knows he will never die by suicide because he knows he can just keep going. When there's no hope, there is still hope. I call it hope beyond hope. It's an older phrase, been around for probably centuries, but I call it hope beyond hope. When you've lost hope, there's other things that will just keep you going. One lady said it like this: with mental illness, your mind will not, your mind may not show up for you, but your body will. Other physical illnesses can take control of your body, but with mental illness, your heart will keep beating, your lungs will keep breathing in and out, and it will keep you here. It will show up for you when your mind can't. And I just wish more people knew that. I didn't know that. In 1994, when this disease hit me, I didn't know anything about mental illness. Or there's so many resources now online, and people are talking about mental health so much more. I really encourage people to start reading about how to get themselves better with mental illness, reading, watching videos, whatever. There's so much there, so many tricks. There's so many books that have been written about this. There are books in the self-help section, in the personal development section. I'm in the business and career section a lot, reading books by CEOs and top athletes on how to improve their mindset, their resilience. There's so much to learn. At my worst in 94, a lady saw me walking down the street, and she said I looked like I was walking through a world of flying glass. And I'm like, yeah, exactly. That's exactly how it feels. Thanks for noticing. I was never classified as a paranoid schizophrenic. I never thought anybody was after me or anything, but it was very scary. It felt like every step could be my last. Just sheer terror, not knowing how I was going to make it through the next few minutes alive. It's that feeling. It's a nice sunny day. I wasn't under any stress. Other than schizophrenia, my life looks pretty darn good, but it just is so difficult to keep going. But I don't know why, but I never looked up any content on mental illness in developing countries until 2017. And Vikram Patel's TED Talk burbled up into my feed, and I watched it, and I'm like, oh my gosh, this is the first bit I've seen about mental health in developing countries. All those years of walking through a world of flying glass, my heart went out to people with mental illness in developing countries, in extreme poverty, in war-torn countries. I went through it with one of the better mental health care systems in the world, although it needs work. In a sleepy part of Canada, not much violence here. It's very calm and peaceful. And I felt like I was living in a war zone. And anyway, so after I saw his video, his TED Talk, I started looking up the cause. And there are lots of people helping. It is vastly under-resourced, but there are people helping. There are groups helping. And I found, though, that these groups and people were scattered across the web. So I thought, well, what if I make a website with all these groups on one site? So I did. I called it MindAid, mindaid.ca. And it's the world's first website, as far as I know, with all the groups helping the cause on one site. And I made that in 2018. It's getting some traction now. More people are starting to pay attention to it. And it's basically, it's just a simple curation site. I've been reading books on how to start a nonprofit or a social business. Maybe in the future, someday, I will have a nonprofit accepting money and donations and getting people on the ground delivering models of basic mental health care. That's how they do it with basic mental health care. And I may do that one day. Right now, I'm just a promoter of groups already doing the work for them. I have no staff, no employees. It's just me and a website and social media. but I want to build their capacity. They're already doing great work, and I just want to get more people. I want them to be mainstream conversation. Who here has heard the word UNICEF? What does UNICEF mean? We all get UNICEF. We all get that. How many people have heard of Strong Minds or Fine Mind or Try Global or Partners in Health, CBM UK, Minds Foundation? They're all doing work with mental illness, with mental health in developing countries. And if more people knew about them, how many people have bought goats for people in the last 10 years, 30 years, or sponsored a child in Africa, or paid money to drill a well, or build a school, or buy school books or farming tools? We've been doing this for decades. We've spent millions upon millions of dollars getting people the basic needs to survive in life. How much money has been spent getting their mental health care better, helping people with depression or OCD or anxiety, schizophrenia? How much money have we spent? It's piddly, not much. Now, if there is ever a time in history that mental health in developing countries could pick up speed, it's now. We've been talking slowly more about mental health the last decade or so. And then when COVID hit, mental health is out in the wide open now. Everyone's talking about it. When I mentioned to someone, some random stranger start talking, it's easy to talk about mental health in the grocery store now. It's easy to throw that into a conversation. It's talked about. I couldn't 10, 20, 30 years ago. I had to sniff somebody out before I mentioned the word mental health. Now you can talk about it. It's everywhere. So when I talk to someone in the grocery store and say, we get talking about mental health, because I often try to steer the conversation that way, throw in mental health in developing countries. People get it in a second. We've all known about donating to people with developing countries for their basic needs, and throw in mental health. Oh, okay, I never thought about that. Oh, yeah, what do they do for their mental health? How can we help them? And it doesn't take long for it to click in people's minds. And that's why I'm encouraging people to have conversations about this, to get people talking about it. And I encourage people to go to my website or to go to the nonprofits that I steer people towards and have them more mainstream conversation. I was desperate for help, and I got treated mental illness. They estimate over 270 million people in developing countries, and I think that could be a low number, have no mental health care. Nothing. They're untreated. They're crying out in desperation for help. Please, somebody help me. I was desperate. We don't talk about desperation that much in our society. Often we steer away from people who may be desperate in a relationship or desperate to do business with you. For some reason, we steer away from that. If someone's desperate to save their life, you go Google that headline. There are hundreds and hundreds of headlines. Man desperately tries to save his life from whatever flood or bear attack or anything. It is written so many times, desperately tries to save their life. I was in desperation. Please, somebody help me. And there are so many people out there desperate today. They can't feed their family, which is crucial if you're in extreme poverty. If you can't get out of bed and feed your family, it's unbelievable. Some people are actually kept in chains with mental illness. They estimate hundreds of thousands of people in 60 countries have untreated mental illness. They're tied to a bed, tied to a tree, their foot through a log, kept in the shed. And it's horrible. The good news is that there are people helping them and unchaining them. They have unchained many people, and they keep working on it today, tomorrow, the next day. They keep unchaining people. Robin Williams' son, Zach Williams, and Tim Shriver, founder of the Special Olympics, they are helping promote a platform called #BreakTheChains. And the link is on my website. They have a pledge there that you can sign. They're looking for 20,000 signatures to help get more help for people. So
all your information is in the link below. So viewers that are watching this can click on your link and go to your website and see all of the things you're referencing now.
I really encourage people to go there. I would love if it got more traction, and it is starting to get more traction. I was recently in LA Weekly. It's got 4 million readers per month, so I'm very happy about that. That's the biggest bit of press I've gotten ever for MindAid. So I'm very just tickled about that.
Congratulations. That's fantastic.
Thank you. Thanks. When somebody walks in, they're horribly mentally unwell and they're looking for help, and they walk into your office, they walk into the building. How many seconds is it before they get looked at? Do you have them sit down in a waiting room and then another waiting room? Do you have them fill out forms, or do you treat them immediately?